Good morning, everyone, and thank you for joining us here today for this third webinar in our series on healthcare cuts in the new Congress. Next slide, please. I am Danelle Desiree. I'm the communications here at Tennessee Justice Center, and I will be moderating today. And we have with us also Michelle Johnson, our executive director, and Gordon Bonneman, our staff attorney and co-founder of TJC, along with Michelle, and Ashley Bell Sievers, program director of Family Voices Tennessee.
Really honored to be spending this new day and this new year with you all. Jimmy Carter says we have to inspire our children and our grandchildren to take on challenges and risk that at first may seem to overwhelm or even impossible. But they need to understand that the only failure is not trying. And that's a quote that I read 8 years ago when we were fighting this same battle to protect Medicaid. Having worked in Medicaid advocacy for decades, it felt impossible to imagine that by educating our friends and our neighbors about these challenges in Washington, that we could somehow push back this tidal wave. And yet 8 years ago, we did. We did, and in fact, more people understood Medicaid than had ever understood it. And so thank you for joining and spending time today learning more about how you and the folks that you know can use your voice to protect this vital program, this program that makes such a difference for our state's economy, for our neighbors, and for our healthcare infrastructure. I'm honored to do this work alongside of all of you. And I believe that if we continue to get the information we need and use our voices, that we can win again. Nelson Mandela says it always seems impossible until it's done. It always seems impossible until it's done. And so let's get it done. I'm going to pass it over to Gordon Bonneman and let him share all the scoop with you all. Have a great day.
Okay. Let me go over a few housekeeping items initially. First, thank you all for joining us. The webinar is being recorded, and the recording and slides will be available and will be emailed to all registered participants by January 10th. The last 15 minutes of the webinar will be Q&A, and we look forward to a lively discussion then. If I could ask you all to do so, please introduce yourself by putting your name, organization, and the county that you're from in the chat, just so we know who's with us today. Next slide, please. And I'm going to read this disclaimer just because we are a nonprofit, and I know our co-sponsor, the Disability Coalition, is also a nonprofit. We are both nonpartisan, non-political, and those we serve and the partners with whom we work represent the state's diversity of political affiliation. Our political analyses that we'll share on these conversations relate solely to the defense of health and nutrition programs and do not imply endorsement or disapproval of any party or person. Next slide, please. So just to tell you quickly, I know that many of you have been participants in earlier conversations, but we're going to just quickly recap those. It won't take but a minute for those who may be new to the conversation or who have forgotten some key points over the holidays. I'm going to share latest intel regarding congressional developments. And then we're really grateful to have Ashley with us to talk about using stories to win and putting a human face on the issue. And she will let you know very vividly how impactful that can be. We're going to allow Q&A at the end. Look forward to that conversation, and then we'll close with a call to action. We had anticipated when we scheduled this that with Congress convening on January 3rd, last Friday, that there might be more to report in terms of the unfolding congressional drama. Things have been slowed a little bit by former President Carter's death and the polar vortex in the Washington area. So for those reasons, things are a little bit slower, but we'll tell you what we do know. Next slide, please. So as you probably know, if you followed the campaign of President Trump at all, tax cuts were #1 priority for him and for the congressional majority that now controls both the House and the Senate. And that ties to Medicaid because the leadership in both houses have talked of using cuts to safety net programs, most notably Medicaid because of its size, to offset the lost revenues that will be needed to pay for the taxes that are to be cut. Those have to be paid for under congressional budgeting rules, and they're going to be looking for big savings in safety net programs. President-elect Trump has taken Medicare and Social Security off the table, says those will not be subject to cuts. And if you then look at what's left, where they can pick up the $2.5 trillion that the leadership is talking about, looking for, Medicaid is standing there with a huge bullseye on it because it's the largest entitlement program. Not because poor people enjoy getting health care, but because they need it. And healthcare inflation has risen for more than a half century more rapidly than the rate of growth of the economy as a whole. And so Medicaid has just gotten bigger and bigger as a result of healthcare inflation. And it's the big, slow-moving target for all of the budget cutters, which makes it extremely vulnerable. Next slide, please. The wheels are in motion behind the scene, even though there's not been much said. Politico and Axios have reported yesterday and today in their editions that the Republican caucus in the House Republicans met in retreat over the weekend. Again, they set tax cuts as the #1 priority, and they affirmed an intent to use Medicaid as the way to pay for it. Again, talking in terms of $2.5 trillion, which is just staggering. So even though there's not been much in the mainstream media, we know it's happening. And once they go public with it, it's likely to go very fast. Next slide, please. The saying in Silicon Valley for a decade or two has been move fast and break things, and that's going to be the way the Republicans will move the Medicaid cuts forward. They've learned a couple of things from 2017. Some of you undoubtedly will recall that there was a big effort to slash Medicaid as part of a broader effort to cut the ACA or repeal the Affordable Care Act, Obamacare, when President Trump served in his first term. And in that first year after he took office, 2017, there was a big effort to block grant or otherwise cut Medicaid. And it didn't happen. It was a very narrow victory, but thanks to a lot of people's efforts, including people in Tennessee, it was stopped. And that gives us confidence that we can stop it again this year. But it was a closely run affair, and this promises to be a tough fight. The lessons that were learned was that in 2017, the Republican leadership made a big show of we were going to slash the ACA, we're going to slash Medicaid, and the effect of that was to immediately put everybody on their guard. The people who needed those programs, relied on those programs, immediately were galvanized into action, and there was a huge outpouring, and the public came to understand how disastrous those cuts would be, and that's what ultimately stopped it. So now they're opting for more of a stealth approach. That's why you haven't seen grandiose claims about slashing Medicaid, but we know from leaks from the caucus discussions this past weekend that they are in deadly earnest, and specifically the conversation seems to be focusing on imposing per capita caps, which I'll talk about in just a moment. So they're downplaying the changes, and they're also trying to move very quickly. before resistance can form that could slow things down, because things did get slowed down 8 years ago, and it gave us all an opportunity to mobilize and ultimately stop it. So they're not going to make those two mistakes again. They're going to be quiet about it, and they're going to be and try to. I mean, the comments I already read in Politico, were the chair of the relevant Medicaid drafting committee in the House was saying, well, per capita caps aren't really caps. They would allow the program to grow. For reasons we can discuss, that's not exactly accurate. It would grow, but it wouldn't grow enough to keep pace with inflation, as is well understood, and that's where the savings would come from. So they're trying to downplay it as opposed to make a big deal of it as they did before, and they're going to move really quickly. And let's talk quickly about how they will make it move fast. Next slide, please. They're going to use the budget reconciliation process, which involves a two-step process. First, Congress adopts a resolution by a simple majority, and of course they have majorities in both houses of Congress, that says we intend to make these cuts in taxes or revenues and make these adjustments in spending, both sides of the budget, both revenues and expenses. Those are our budget marks for the budget for the next fiscal year. And now we're going to send that resolution to the various committees that draft legislation, and their task will be to make such changes to the programs as are necessary to achieve those budget marks. So what they would do is they'd say, we intend to take $2.5 trillion or whatever the figure would be over the next 10 years out of Medicaid and SNAP or Medicaid and other social programs, but primarily Medicaid because it's so large and that's where the money is. And then over the coming months, once that resolution is passed, the various committees would draft in the Senate and the House would draft amendments to the Medicaid Act that would achieve those cuts. Most likely what they would do is adopt reductions that would save the federal government the sought after savings, but that would leave to the states that actually administer the Medicaid program the politically unpopular burden of actually deciding which services get cut, which enrollees lose coverage, and how much to cut the providers of those services. So they'd leave the dirty work to the states. So we won't, the importance of understanding this is that if we wait until we know precisely who's going to be cut and in what ways, it'll be too late. We have to act now while the budget resolution is being put together. Next slide, please. And one thing to understand about the budget reconciliation process is you will recall that it requires 60 votes to overcome a filibuster in the Senate, and that's been a firewall. It was a firewall 8 years ago when Senator McCain denied the Republicans a crucial vote that would have made it possible to cap Medicaid and repeal the ACA. If they use the budget reconciliation process, it only requires a simple majority. It cannot be filibustered, and only limited amendments are allowed on the floor. So it really greases the skids. That's why, again, we want to get upstream from that to address it right now when they're putting together the budget resolution, excuse me. Next slide, please. The question that everybody wants to know is, how will the Medicaid show up in TennCare? How will it affect my TennCare? In the case of those who are either receiving TennCare themselves, the 1.5 million Tennesseans who receive TennCare right now, or who have loved ones who rely on TennCare for their coverage. And the answer is, again, we won't see the details until after Congress has cut the budget. But what we do know is that there are only 3 ways for the state, which administers the program, to manage the money that they are sent from Congress. They can either cut people by cutting off their coverage and saying you're no longer enrolled in TennCare. They can cut the services by saying we're now, instead of covering 5 scripts a month, we're only going to cover 2 scripts a month, prescription drugs a month. They can mix and match in that way, and then they can cut the rates. that are paid to providers. That ultimately, all of those ultimately cut people, including the rates, because providers do not have to take TennCare, and they will refuse to serve TennCare patients if they're not paid enough to pay their own bills. Next slide, please. The proponents of these cuts will use camouflage and complexity. They will use work requirements and other red tape, which is not an explicit cut. It just makes it very difficult to navigate the process. They could use block grants. They could use per capita caps. They can reduce the federal match. They can roll back the funding for Medicaid expansion. As you know, Tennessee has not expanded Medicaid. There's a large pot of money out there for us. If we do, when we do, it would take that away, eliminating the prospect of Medicaid expansion ever in Tennessee and rolling it back in the states that have already done it. Or they could eliminate or limit the use of state provider taxes. Those are all complex fiscal issues. Most people don't understand them, including tellingly many state lawmakers who would be affected by it. We're not going to get into that. Just understand, for our present discussion, all we need to know is there are infinite ways for Congress to cut the Medicaid program. Any significant cuts will hurt people. We don't want to get bogged down in the details, and they will use the complexity of it to try to say, move along here, nothing to see, pay no attention, etc. We need to be on our guard. We need to be acting now. Next slide, please. Our answer to their complexity and camouflage is simplicity and strength. We're not going to get bogged down in the details. We're going to keep the focus where it needs to be, which is on the people who would be affected. Families, hospitals and nursing homes, the economy of entire communities, and what it does to medical debt. So we need to get that message out. And the best way to get that message out will be, and we're going to have a call to action at the end, but at this point, next slide, please. I want to turn it over to Ashley because she's going to demonstrate very vividly the power of stories to make the point that Medicaid is critical and it needs to be protected, not cut. Ashley, please take it away.
Thanks, Gordon. And we can drop the slides for now. So we know that TennCare is Tennessee's Medicaid program, and it's a lifeline for our Tennessee families. It provides vital access to care for nearly half of the children in our state, with the majority of those kids having disabilities or complex healthcare needs. I grew up in Upper East Appalachia, the daughter of a working class family, and I was raised by my grandma. I was also diagnosed with pediatric cancer. I was young, I was terrified, and so was my family. My grandma wasn't just terrified that I had cancer. She was also terrified that she couldn't afford the treatments. I've seen firsthand how TennCare can transform and save lives because TennCare saved mine. TennCare allowed me to grow up. TennCare allowed me to become a first-generation college student, paving the way for my brother who followed in my footsteps. So let me be clear that TennCare is not a handout. It is a hand up to those who need it the most. TennCare's investment in my childhood allowed me to break the cycle of poverty in my family. Let me say that again. TennCare's investment in me allowed me to break the cycle of poverty in my family. Cuts to Medicaid will directly or indirectly hurt everyone. For our children, TennCare ensures they have access to routine checkups, vaccinations, and treatment for illnesses. Without coverage, children with chronic conditions such as asthma, diabetes, or developmental disabilities will face disruptions in care. Delayed treatment leads to worsening health conditions, increased emergency room visits, and ultimately higher healthcare costs. Cuts to TennCare will force many parents to choose. Do they pay for rent? Do they buy food? Or do they pay for their child's medical care? Which of those would you choose? For families of children with special healthcare needs, TennCare is often the only means of affording therapies, medication, and medical equipment because private insurance will not cover it. Parents want to be self-sufficient. They want to provide for themselves. I can still remember now how I felt every time I pulled out my TennCare card at a doctor's appointment. Every time I showed up for my 2 o'clock appointment on time and had to sit in the lobby for an extra hour because 3 other people were booked for the same time slot as me, so the office could make up the rates to the providers. The looks of judgment, from people without knowing I was working 3 jobs to put myself through school. TennCare recipients are not strangers at the local health department. They're our neighbors, our coworkers, church members, children, grandchildren. Supporting TennCare is about living out our Tennessee values. Most of you know me as a director of Family Voices of Tennessee, and I have the privilege of witnessing the impact of Medicaid every single day in the lives of Tennessee families. When Gordon asked me to present today, I reached out to a few families to share how TennCare has impacted their lives. Within less than an hour, 10 families responded, just showing how invaluable Medicaid is. For one family, TennCare allows their daughter to receive nursing care and specialized therapies at home instead of living in a hospital or an institution, keeping their family together and saving tens of thousands of Tennessee taxpayer dollars each and every month. This is Asher. She will be turning 12 years old this month and is arguably the cutest thing you ever did see. Her family lives in rural East Tennessee, and her mom drives 4.5 hours one way for Asher to see her doctors. That is a 9-hour round trip. For the family whose child sees 17 different specialists and relies on around-the-clock nursing care, she's covered by TennCare's Katie Beckett program, named for a child with complex healthcare needs who inspired the creation of special Medicaid coverage that enables medically involved children to live with their families rather than be institutionalized. This is Claire. She is 10 years old. She had open heart surgery days after her birth before being diagnosed with a very rare genetic condition. She is a fighter. Her parents are a nurse and a professor, and having TennCare as secondary insurance allows them to, quote, keep their head above water, according to mom. TennCare allows her parents to keep their jobs, literally saving lives as a nurse and educating the next generation as a professor. For another family, TennCare paid for the cost of chemotherapy for their son. This is Tripp. He was 2 years old. His mother shared that if it wasn't for TennCare, I never would have been able to pay for any of his treatments, and he would have suffered and passed away a lot sooner than he did. TennCare gave this family peace, knowing they did everything they could for their baby. For this family, TennCare covers the cost of hearing aids and supports the family with transportation assistance to medical appointments. This is Andrea. She is 8 years old, and she is one of 3 children born with hearing loss. Do you have any idea how much hearing aids cost? Until this job, I didn't either. Nearly $2,000. Now, if you multiply that by 3, I'm not great at math, that's a lot of money that this family has to put out just for hearing aids, not including all the appointments that go along with that. And hearing aids also have to be replaced frequently as children grow and their ears change. Significant amount of money just so that child has access to language. The Employment and Community First Choices, also called ECF program, allows this individual to work and live in his community with support. This is my son, Zach. He is 20 years old. I met him as his foster care worker, and now he works 4 days a week at a convenience store. He just got his first girlfriend, pictured here, and with a little help and support, is able to live independently in his community. This is Elijah. He is 10 years old and recently had hip surgery to preserve his future mobility and independence, made possible by TennCare. Notice he is also wearing hearing aids. For many children with special healthcare needs, they often have more than one diagnosis and need multiple supports, therapies, specialists, sometimes tripling the cost of their care. This is Ashton. He is 5 years old. He has autism, and without TennCare, his mother wouldn't be able to afford his ABA therapy, which is incredibly expensive if you weren't aware of that. This last one is Stella. She is 7 years old, and TennCare allows her access to very expensive mobility equipment that enables her to live her best life and increase her independence. These cuts will impact all Tennesseans across the lifespan. Next slide. Our children, mothers, fathers, grandparents, and other folks that we know and we love. I could go on for hours showing you photos and telling you stories, and just looking in the chat box, most of you have your own stories that you could be sharing right now. These are not the exceptions. They are the reality for thousands of Tennessee families. Actually, before joining this webinar, I learned about eligibility changes in the ECF program that quietly went unnoticed in November 2020. If families were enrolled in ECF before November 2020, their services are unaffected. However, for those who joined after November 2020, The revised eligibility criteria has significantly restricted access, which will lead to many individuals losing services as they go for renewals. And we're working on getting more information about that. But as Gordon mentioned earlier, these anticipated TennCare cuts are likely to prompt more stuff like this, more eligibility requirements across programs, making it increasingly difficult for individuals to qualify for essential services. TennCare is about more than healthcare. It's about giving every person, every child, regardless of their circumstances, the opportunity to grow, thrive, and contribute to our great state. When we support TennCare, we're not supporting handouts. We're supporting families. We're investing in Tennessee's future by keeping children healthy, keeping families together, and keeping communities strong. I promise you, someone you know and someone you love benefits from Medicaid services and will be impacted if these cuts are made. Thank you. Back to you, Gordon.
Thank you so much, Ashley. Well, it's kind of hard to follow that act, and I'm not going to try. So we'll just open it up to Q&A, and you can put your questions in the chat, and we will try to address them. All I can say, Ashley, is that that was just fabulous. Thank you so much. Thank you so much to the families that lent you and us their stories. And I suspect that for everybody on this call, me included, you won't remember much of what I said this time tomorrow, but I promise you that this time next year and this time 10 years from now, you remember what Ashley has said. So we have to tell these stories far and wide because that's what will carry the day. I heard a wise judge one time say, nothing kills a theory like a fact. And that we need to share the facts about what this means in people's lives. And that will kill all sorts of abstract economic theories about trickle-down economics or the benefits of whatever policies Congress might come up with that have the effect of cutting the program. So do we have any questions? One question is, what makes Medicaid stand out from other programs that are also at risk of being defunded? Good question. And the answer is its size. It is the largest entitlement program in the country. And by entitlement program, just for a quick digression, most federal funding is appropriated annually in specific dollar amounts, where Congress says we appropriate X billions of dollars for this particular project, for example, for NASA, the space program. But there are certain programs, including Medicare, Social Security, and SNAP, the formerly known as food stamps, and Medicaid, that are known as entitlements, because in those cases, Congress writes the eligibility rules for what qualifies or entitles someone to receive the benefits of participation in the program. And then instead of appropriating a specific amount, a block grant, it appropriates such funds as are necessary to cover whatever services end up being needed for the people who are eligible. They can't know at the beginning of the fiscal year how many people will be eligible for Medicaid or for SNAP or for these other programs. So they say, we make a commitment to the American people that if you meet these criteria, then we will fund these services at whatever level of funding is necessary to fulfill the pledge to you that's in these laws. So these are known as entitlement programs. And if you look at where the money goes in the federal budget, remember the old adage of Willie Sutton, the bank robber in Boston, who explained when captured why he'd robbed banks. He said, well, that's because that's where they keep the money. Well, if you are getting ready to do a $4 trillion tax cut that will benefit primarily the wealthiest of Americans, and budget rules require you to come up with so-called pay-fors to offset that, you're going to go and rob the banks because that's where they keep the money. And in this case, back to the question of why Medicaid. Medicaid is where a lot of the money goes. If you're not going to cut defense, President-elect Trump has said he will not cut defense. If you're not going to cut Medicare or Social Security, which he has also pledged not to do, and you look for what's left where there's a lot of money going out the door, it's to Medicaid. And again, the reason is not that people who are enrolled in Medicaid are enjoying getting sick and needing the services that they require. It's because healthcare is ever increasingly more expensive.
And
And
that's what is driving it.
From, can they cut people from the MSP categories of TennCare, like QMB, SLMB, and QIT? And just to provide a little simultaneous translation from Medicaid speak into plain English, MSP stands for Medicare Savings Programs, and the other alphabet soup that was in that question relate to certain categories of the Medicare Savings Program. It's a very important program that supplements Medicare. Again, Medicare is off the table, but not the Medicare savings programs because they're part of Medicaid. And what those programs do is they pay the premiums and the cost sharing and the deductibles for Medicare beneficiaries of limited means who would otherwise not be able to afford the substantial cost burden that is left when Medicare stops paying for their services. So in order to make Medicare effective for low-income seniors and people with disabilities, that's what the Medicare Savings Program is for, but it's run through Medicaid. So that program is absolutely at risk. I think that the bottom line to all these questions about what will be cut, will my services be cut, or will the services that I'm involved with directly or indirectly be cut, is that any way they slash Medicaid, certainly at the levels at which they're talking, nothing will be safe. Everybody will be affected. And we can't wait to know the specifics of which of the Medicare savings programs might survive or not, or how badly it might cut, or how other Medicaid services or eligibility might be cut. We have to get in front of this thing right now and try to affect the budget reconciliation process. Here's another question, and it's an excellent one. My congressmen and senators no longer respond to my emails because they do not agree with my positions, such as not cutting Medicaid. How else can I try to make a difference? And thank you very much for that question, because I think all of us who follow Tennessee politics understand that our delegation, with the exception of Congressman Cohen, is the sole Democrat in the congressional delegation from Memphis, are very loyal to Trump, very reliable votes for whatever the Republican Party position is on these issues. And so you're probably sitting there thinking, well, what good will it do to contact them? And the answer is that we are ultimately speaking to the leadership through them. They're going to vote for whatever's put on the floor and that they're asked to vote for by their leadership. But the communications between the delegation and the leaders is a two-way prospect. I mentioned at the top of this discussion that the Republican House Congress caucus met this past weekend in retreat. And there was a discussion that's been leaked partially talking about these cuts between the members and the leadership. And the bottom line is, at least according to the leaked information this morning, notice that they're looking at per capita caps, but no hard decision has been made yet. That's our opportunity. We need for the speaker and the leaders of the relevant committees, when they poll their caucus members, what are you hearing from your constituents? They need to say, we're getting a lot of calls, people worried about cutting Medicaid or these other safety net programs. And that influences the leadership. Remember that there is only a 3 or 4 vote Republican majority in the House. So they cannot afford the defection of even 2 or 3 members, and they lose their majority in the House. And unlike the Senate, a tie is not broken by the vice president. So the leadership has to get a majority through the House. The Senate It's pretty much a foregone conclusion. But all the leadership needs to hear that if you want to pass the tax cuts, which is their priority, don't make it dependent upon cutting Medicaid, because you're going to pick up a lot of headwinds from that. And it could be possible for the opposition to peel off 2 or 3 votes, which is all they need to do to bring the whole thing down, including the tax cuts. So all members of Congress, including those that ultimately will vote for whatever President-elect Trump puts before them, need to be providing feedback to the leadership. Don't couple tax cuts to Medicaid cuts. So we're not insane when we're asking you to contact members of Congress that you know would be perfectly happy themselves to vote for Medicaid cuts, because they are sources of feedback to the leadership who will be making the crucial decisions. People are asking what else they've done. Is they've already contacted our congressional delegation, and very much appreciate your all's doing that. I think what and one question is, how do we engage the Democratic Party to reject the cuts? Right now, this is all happening in Congress. This slide says contact your legislators. We should be clear here. It's not state legislators at this point. It ultimately may be, if cuts go through and are sent down to the state to ultimately decide what gets cut. But we want to keep that from happening. Right now, it's contact your legislators who are in the federal Congress. So how can we persuade Democrats to stand firm against this? I think right now it's pretty much divided along partisan lines, and I think Democrats, we don't have to worry about defections. At some point we might have to, not right now. The focus really needs to be, and the Democrats have nothing to do with the budget reconciliation process. They're totally shut out of that. So it really is an inside baseball game inside the House Republican caucus, with the leadership being persuaded that they don't want to complicate the path to tax cuts by coupling it to Medicaid cuts. Other questions? These consistent cuts cause persistent instability in the healthcare sector, hurting patients and physicians. Aren't these types of cuts un-American? Well, I think, unfortunately, right now, our healthcare system has a lot of strains on it, and I'm not sure whether, when you compare it to other countries, I'm afraid our American system is under more stress right now than in a lot of other countries. Can you elaborate on who the different groups are encompassed under Medicaid, low income, nursing home, HCBS, et cetera? This is important for strategizing. Yes, thank you. We have a fact sheet that we are going to send out with this that details those kinds of factoids that are so important. Medicaid, TennCare, which is what we call Medicaid in Tennessee, for example, covers half of all births, half of all prenatal care, half of all postnatal care, half of all children all the way up to age 18. So that's only one factor. It covers 3 out of 5 nursing home residents, and an even larger percentage of those who are getting care at home. It's the primary source of coverage for people with disabilities, including very severe disabilities, including children with special health care needs, as Ashley so eloquently explained. So that's why stories, just to go back to the point that we want to make here, we need the stories, because that's what will move hearts and minds. Would it help to contact the governor's office to advocate to the U.S. congressional leaders on behalf of TennCare? That's an excellent question. One point that we want to try to make, excuse me, is that federal Medicaid funding is 18% of the state of Tennessee's budget. It is such a huge part. I mean, nearly 1 in 20 cents out of every dollar, nearly in the state budget consists of federal Medicaid funding. If that gets appreciably cut, that has ripple effects across the state budget. So if you look at what's number 2 or number 1 in the state budget, Medicaid is the second largest item behind K through post-secondary education. Education is the largest share of the state budget of any single item. And so if you take as much money out of Medicaid as being talked about, you can't help but have a ripple effect across the entire state budget. And everything is at risk, and education in particular. Again, the Willie Sutton rule: if you need to cut money, if the cuts trickle down to or rush down to the state level, the state absorbs a large reduction in its federal revenues from Medicaid, it's going to have to look for reductions in its own expenditures. And if you go where the money is, that's education. So we want to get the message out to state lawmakers and to the governor and the cabinet that folks are talking in Washington about handing you a very hot, very unpopular potato, which is the burden of making do with much less federal money that will ripple across the state budget. So if there are ways to communicate to the governor about this, if you've already contacted the congressional delegation, I think trying to alert state officials is a good idea. The priority right now is focusing on Congress because the timeliness of the budget reconciliation process. But if you have avenues through lobbying groups or otherwise, organizations, to make them aware of this and to have them have their lobbyists raise alarms with state officials, that would be quite helpful. Again, congressional leaders, specifically House leaders in the Republican Party, need to hear from a host of different constituencies. If you mess with Medicaid, you endanger the prospects for the big tax cuts that are your priority. So you've got a QR code on your screen now, and just want to quickly run through some things to do. That QR code will connect you easily to be able to send messages to the two senators and your own member of Congress. We are also going to post a sign-on letter for organizations, not individuals, but organizations. We want as many organizations as possible to sign on. It's a letter to the members of the delegation that just makes the case that we're making here. It's one page. We'll have it posted within the next 24 hours, I hope. And that QR code will connect you to that as well. The main thing is we are trying to get the word out ahead of when it makes headlines. This will ultimately make headlines. If they pass a budget reconciliation process resolution that has $2.5 trillion in Medicaid cuts, as is currently being discussed in the caucus, it will make headlines. The problem is if they pass it, and they won't unveil it until they are pretty sure they can rush it through quickly, we're going to be way behind the 8 ball. So please get the word out. Again, this will be posted tomorrow. Please share your stories. Thanks again so much to Ashley for sharing hers and those of the other families who have been supporting her efforts and our efforts. We need those stories. That's what will carry the day. It carried the day eight years ago. It will carry the day again in the coming year. One more thing before we sign off, which is we are going to be holding a similar webinar tomorrow on focusing on SNAP and nutrition programs. It's at 11:30 Central, 12:30 Eastern. We've decided to split after the initial webinars that we held covering both of those, we decided to split them up because we thought that some people might be more interested in one than other. SNAP is vulnerable as well. We want to try to get that word out to constituents of nutrition programs. Medicaid, because it's so much larger, is at higher risk, but nothing is off the board. It's almost certain that SNAP will come in for cuts as well. So we want to make you all aware of that. Please share the word. Ultimately, we intend to set up these conversations on a 2-week cycle. as we go forward, because we think things, once they start moving, are going to move very quickly. And we're going to be continuing to work with Ashley, the Tennessee Disability Coalition, and other organizations. And one reason we're going to have this sign-on letter is because we want to, it's a vehicle for making more organizations aware and bringing more organizations into this effort. So with this, unless my colleagues have anything they need to remind me of, we're going to sign off here, give you back 10 minutes. Hope those of you who are interested will join us tomorrow for the conversation about nutrition programs. As you see from this last minute plea, we need your feedback. We don't have a teacher's edition to this textbook. We are working this out as we go. We need everybody's input. Please tell us what's helpful, what's not, what you need for us to do. Thank you so much. We can win this. We must win this. Talk to you soon.